And then I saw no icon where I could unmute myself, or you could see my pretty mug. Somebody's just sitting there trying to figure out what to do. So what do you want me to do? Where are we at in the agenda?
Okay. We're going to let you go ahead and do the OCA update before we start the rules hearing, just in case you don't have all morning to be here.
Okay. All right. Well, the first couple of things. The first one was the to cut to the chase, the chiropractics, the CA study guide. The main issue, the concern that I primarily pointed out was the definition of physiotherapy being tweaked a little bit, and historically it's synonymous with physical therapy. In fact, as I testified before, the physical therapist, without reading our Practice Act language, attempted to restrict us from using the term physiotherapy or physical therapy. So that's the primary concern, to attribute physiotherapy solely to the use of modalities and not other physical medicine interventions like therapeutic exercise, therapeutic procedures, etc. The other update I wanted to talk about was our wanting for the board to consider, and we've been working on this animal chiropractic, that if relative to the need for a referral from a veterinarian, doctor of veterinary medicine, that if a chiropractic physician had one or two of the board, the certifications, had gone through the training sessions and become certified by the American Veterinarian Chiropractic Association or the International Veterinarian Chiropractic Association, that would allow them to treat animals with chiropractic spinal manipulation without a vet's referral. So update workers' comp bill. Again, we're working towards reintroducing our bill, which would reestablish full attending physician status for the life of the claim, so we could treat the patients, but also advocate for them. For the very few, the minor, that have permanent spinal impairment, other impairments, and right now what's happening is colleagues lose their patients to OCMED clinics, and the outcomes are not good. The substandard care, which occurs a good percentage of the time, is not in the best interest of injured workers. This is really about injured workers. We've been filming injured workers with their signed release, telling their stories of once they got to OCMED clinic and what transpired. Also recording stories of chiropractic colleagues who lose control of their patient and the convoluted clinical pathway and lousy outcomes that many of these injured workers end up with once they are unable to see a chiropractic physician. Oregon Universal Healthcare Plan, again, there's a governance board which took over for the task force. I testified in front of this committee, this board, just recently about the need for provider non-discrimination to live on if we in fact adopt a universal health plan, which is a possibility, not sure if it's a probability, in 2027. Those non-discrimination provisions must live on. And Governor Kitzhaber, Governor Brown, and our current governor are very, very supportive of those non-discrimination provisions as it pertains to participation, coverage. If it is, I heard mention of our scope and how some other states were very impressed by our scope. Well, we got an administrative rule in 2017 that if a covered service is within our scope of license to provide, and we provide it, chiropractic physician, then the insurer must reimburse us for that service. They can't say, well, we don't typically pay chiropractors for that service. Well, that absolutely must live on in any universal health plan. The Oregon, again, we're supportive of the consent law being changed for chiropractic physicians, that Oregonians age 15 could give consent for chiropractic care. And we will lobby for that with the board. Next issue is Oregon Family and Medical Leave language. We have a senator that's going to introduce legislation to remedy this. This is a stipulation in Oregon statute that utilizes archaic, antiquated, and unscientific language applied to us that has its origins in the 1960s. And we're the only ones that have something bootstrapped to us as far as healthcare providers. And it's under subsection L, and it reads as such. And this needs to be amended. A chiropractic physician license under, this is who can authorize, certify a family leave. Chiropractic physicians under ORS 684054, but only to the extent that the chiropractic physician provides treatment consisting of manual manipulation of the spine to correct a subluxation demonstrated to exist by X-rays, which is nonsense, and it's antiquated language, and it would require that we X-ray every individual that we wish to provide a family leave certificate for. The next issue is the Opioid Settlement Prevention Treatment Recovery Board. We teamed up with the University of Western States and Dr. Tony Rosner and the clinical outreach director. And this is our proposal to the board. The state received some $325 million from the opioid settlement suits. And what we're asking for and recommending is a 1-hour e-learning to be produced by the University of Western States, hosted by the University of Western States, to prescribing healthcare providers, explaining the substantial education, training, clinical training, typical conditions we treat and the modalities we use, treatment interventions we use, and the evidence to support those, to educate the prescribing healthcare providers so that they more readily are willing to refer to us, because many of the medical healthcare providers really don't understand or know our substantial training, clinical skill sets, and what we treat. Lastly, the Medicare Chiropractic Modernization Act. We are kind of plateaued at 167 members of Congress sponsoring our bill. Every member of the House delegation from Oregon, except Republican Bentz and Far Eastern Oregon, are sponsors. We hope to get it inserted into a particularly large bill that will be moving. And then last issue is the clerkships with the Portland VA have been reestablished. There's one chiropractic physician, one student at the Salem Clinic going through a clerkship, and then there's one at the Portland VA Hospital Medical Facility up on the hill. As I understand, there's now 7 DCs working for the VA, and the first in history chiropractic residency program through the Portland VA is still a real possibility, but it's going to be 3 to 5 years. That's my Oregon Chiropractic Association update.
Thank you so much.
Michelle, I'm just going to jump in. Thanks, Vern. Regarding our legislative concept for the minor consent to treat, I've actually withdrawn that legislative concept at the request of the governor's office and LFO, and just to focus on our budget. We were going to have a difficult time with this budget, and so they just wanted to hone down our focus. So that legislative concept, if we want to move forward with it, we'll either come back probably in the 2027 session. Just want to let the board know.
Thank you. Okay, so we are going to jump down to number 7 to our rule hearing.
Yep. I'm going to go ahead and show the comparison fees first, Cass.
Well, actually, so yes, so our notice went out that we were going to be updating our fee rule, but we didn't provide the amount of proposal for it. So meaning we didn't clarify which percentage or what the numbers would be in the fee rule. And so what we're going to need to do is kind of open it up for public comment, close it down, and then finish that rulemaking for the rule, and then re-enter rulemaking for the rule with whatever proposal that we want to move forward with, if that makes sense. Okay.
Yep.
So Michelle, when you're ready, if you want to read that, and then we can.
Oh, right. We will now enter rulemaking on OAR 811-010-0008. I feel like it's a long time since we've done this.
And so this is what you're looking at, the jurisdictional, these are at the table, you'll see what the fees will change depending on what percentage we increase them by. And then Washington and California, and I have a whole slew of responses that I received from our FCLB colleagues. So you'll see even just Washington's DC application is $741. So we have quite a lot of cushion between here and there.
I have a question on that. Because their application is so much higher than their renewal, and ours is the reverse. Can we raise different? I mean, it maybe it's challenging, but can we raise different fees, different percentages? If we think maybe the application fee should be higher because there's so much legwork done in the beginning to get it, to get it all complete.
Yeah, I mean, the board can propose whatever the board wants to do. We could, limit the increase to just DCs, or we can limit to just CAs, or we can limit, that the whole, it's kind of open to however you want to handle it. The bulk of our revenue comes from renewals, obviously. And so that's what we would be looking at as far as, how that play out in the long run. Seth, you have your hand up.
Yeah. So Karen, do you think and not be as aggressive on raising the renewal fee? Is that what you're thinking?
Well, if, it's just as a thought, instead of going for a 50% across the board renewal, if it was maybe, a 35-40, but the DC application fee, had just, throwing it out there, just a solid number increase, of, I mean, Washington, it's almost $600 more than it is in Oregon. So if it was, 35% increase with a $500 increase in application, something like that. I just didn't know if that was even worth considering.
I think it's all worth considering. Yeah.
Yeah. Well, I mean, I don't think we should use, I don't like to use application fees as like a stumbling block or a barrier for people to consider coming to Oregon for whatever reason to practice. But at the same time, sometimes over the years of being like on PRC and things like that, we saw physicians that were kind of running from their past, trying to get into other states. And it was like, oh, that's a really cheap application fee. And then we would catch them, back off and go back home or whatever. But I agree. I didn't know, honestly, I didn't know that application fee was in that range. So I agree. I don't think it would be out of the question based on West Coast numbers to go a little higher on that application fee. And I think it needs to be adjusted, but I think it's a good idea, Karen.
Yeah. Okay.
Scott?
Yeah, Karen, I was going to say, I think that's a good idea. My only concern is how many applicants do we get per year versus renewals from a revenue standpoint? And how do we merge that a little bit?
So I can answer your question as far as my projections go, Scott. Just give me 1 second.
Yeah, I'm sure applications are not nearly the bulk of revenue.
No. So my projections for 25-27, DC applications, number of units estimated to be 138 for the biennium, and DC renewals, to give you an idea, is 2,353.
Okay.
So quite a difference.
So the ending numbers in your ED report is that we would increase all those fees by the same percentage, correct?
That's right.
Okay.
And that's, I mean, those numbers, what you're looking at in the ED report, that table is if we didn't take a fee increase right now, and those are only talking about 25, 27. So it's, so that's, so if we took, I guess my point is, if we took a fee increase right now, then we would have a likely, well, with our fall in revenue right now, it's hard to estimate, but we may end up with a higher. Anyway, I'm talking my steps through here. That table didn't include staffing buyback, and so it may be a wash, be flush. So I would just go by that table as an estimated projection.
I just need to.
It still has to go through public commentary, though, doesn't it? If we do a fee increase. Okay,
Yep.
that's what I thought. With the CA licenses, how many CAs do we think actually pay their license fees, and how many do we think the physician who employs them pays the fee?
Oh,
Hard to estimate.
Heather would know that answer, but I think majority of the clinics pay.
Are we talking renewal or application?
I would think all of it.
Well,
Because I think it's different, a little bit. I think
Okay.
sometimes, and Heather, you can answer this too, but I think sometimes it's like you need to get certified before we'll hire you, and then sometimes it's like we'll cover everything. I think a lot of their offices cover renewal, but I know that for some folks who want to work, they've had issues getting the money to be able to renew. Because they've waited and then they have to pay the late fee, and that's unexpected to them, even though like it's the part of the process. So I know that can be an issue for some folks who when their office is not paying.
Cass?
Mhm.
Oh, sorry, Corey. I just had a quick, so 166 times 1.3 is actually 215.
I was wondering somebody to do the math. So what ended up, what those look like is the 4625 is the background check. And so the increases are only on the difference between, like for CA application, you're looking at 146. It's only on the 100 of the increase. Yeah.
Corey?
I think when was the last time that all the increases happened?
In October of 2023.
Okay. So is there a plan of like how often it happens, or is it just based on, the budget projections, or do we have any kind of plan on that?
Yeah, well, that was kind of to Emily's, somebody's sharing a screen. That was part of Emily's point, I think, is to really analyze what percentage you want to go up now. If it was, ideally, we should have a 50%, frankly, a 50% increase. But I don't think it would be tenable politically to have a 50% increase. So what she's saying is do as high, essentially what I read is do as high as we can, which is probably a 30 or 40, and then come back in 25, 27 and review it, because we'll be reviewing it all the time, to see if we need an additional 15 or 10 or 15 increase. But really the goal would be to only do it every 5 or 7 years.
Yeah, do you know historically why? I'm stuck on this for some reason. Because the CA application fee is higher than the renewal, but it's the reverse for Kairos. Do you know why historically it was like that?
I don't know why.
Okay. That was where I kind of feel like we have room to raise at least the DC application fee, high as a percentage higher than everything else that we raise.
Mm-hmm.
Well, the CA application, I mean, that's $20, right? Compared to a DC. I mean, you think scope and what they're really doing, shouldn't there be a bigger difference?
Yeah, for sure.
Mm-hmm.
You would think so. And just to give you a sense, I mean, Lori can attest to this. Me as an attorney, a licensed attorney in the state, these application and renewal fees are like astronomically low for me. Like I just kind of look at this, go, wow, really? This is all you guys pay.
Do you know, anybody know what the physical therapist application and renewal fees are? Just, trying to think of similar profession.
That's an analysis I didn't do. I just focus on Chiro, Karen.
Yeah.
I don't, sorry. I could find that if you wanted me to follow up, but
I don't know that it matters. It was just a thought.
What was Farm doing? Cass, I know you had that on your ED report.
I'm sorry, what was what?
Pharmacy, didn't they just?
Oh yeah, so part of their budget proposal is a 40% increase in their fees. Yeah, for the Board of Pharmacy. So we're not the only agency kind of in fee increase mode for sure.
So Cass, could we look at the individual line item and increase that? Or does it need to be across the board?
No, yeah, that's what Karen was asking, Lori. So you guys can do whatever you want. You can increase the DC application to, $500 or whatever, and then do a blanket other percentage increase for the rest, or just figure out which ones you want to increase, why. But I mean, for me, for my calculations and my projections, I just did it as blanket percentages just to ease the projection. And I know our policy option package that's being proposed for our agency request budget is at 30%. But that can also be modified, obviously, right now.
So for today, you're asking for specific, like an increased number for our proposal to put out for public comment.
So right now we're just going to ask the board, which one do you want to do? And then we'll put it out to the public for public comment for rulemaking in September. So essentially we're going to close out of this rulemaking hearing because we're officially in rulemaking hearing, and then open it back up to enter rulemaking on the whatever percentage.
So if we were to propose the 50% and then we received negative comments when we opened it up for rulemaking, could we move the number?
Yeah. Yep.
Okay, I'm just making sure I'm understanding.
That's what happened the last time. So the last time we entered rulemaking so January of 2023, I think I had a proposal there of 20 or 30% at the time, and the board, or 25%, and the board went with 20% based on some of the feedback. So yeah, it's all can be modified during rulemaking, during the public hearing.
Because this is Lori, and those numbers are so low, as Cass said. Those are so low. I would say go with 50%, but I also understand from earlier that is probably going to give folks heart attacks and is ultimately not going to be approved by the governor and legislation, et cetera. But because our fees are so low to begin with.
Yeah, the only thing I will say about that is reimbursement for chiropractic services are also much lower. So that is a little bit of a thing, like as far as people getting upset about it. So,
The other aspect too is if you look down this table, a lot of states, we don't charge for a lot of things that we could potentially charge for. We don't charge for duplicate certificates. We don't charge for, if you go down the list of states, there's some really creative things that they charge for that we just don't do. And so that's another kind of question is, in addition, aside from this fee increase piece is, do we want to start charging for certain services that we do currently for free. License verification, for example, or, all those things. Duplicate license fee.
And the thing is, actually, we used to charge a $5 fee for duplicate certificate or license, but we don't mail certificates anymore. So that one kind of went out the door when we went live within Lumen, but we have a lot of verification of license. So that's one that stands out to me as someone who is involved in that process that would still apply, whereas like the duplicate certificate wouldn't.
Yeah.
Well, do we want to play this kind of like a negotiation on a real estate deal and go with 50 and,
I was just gonna say, if we say 50, they're gonna say no anyway. Like if we wanted to raise it 50%.
So the board could put forward 50%. We're gonna get comments and public comment. I just don't. Yeah, we'll get letters. I just don't know how open it would be to being approved in our budget committee. I think we'd be slapped down in budget. In our budget committees.
What if we just played it safe, went with 30% on all the categories, but the DC application raised it to a good like 300?
And just so the board is clear, so at 30%, we are understaffed, meaning we lose a staff member at 30%.
Yeah, 35%.
I think we have to do 40.
40, yeah.
Would we be able to aim high and then negotiate down, or is it would it default if we are denied and then it'll default to 30?
I don't know during our budget committee hearings, I don't know what that would look like. It's really up for the legislature to review and then the governor to approve, and the governor could just say, no, that's too high. We're going to kick it back to whatever is decided. So I don't want to. Oh, Hari, go ahead. You have better.
Just going to ask if he was still on here.
Yeah.
Hey, sorry. I am on here. I switched to multiple screens, and that means I give up my camera. But just to answer a few of the questions that came up, as far as the process, if you guys approve, say 50%, like the next steps that have to happen for you to get that increase in biennium is first you guys will vote on it and make the rules adjustment, and then it will come to me, and I have to write a memo that will then go before the director of DAS, who's DAS is the Department of Administrative Services, and they're kind of like the oversight agency for all of the other executive branch agencies. And that will be kind of a chance for both, she's appointed by the governor as well. And so that is a chance for the governor's office to weigh in. But even if it is passed there's two more steps that it needs to go through. One of them is you will include this. So when you increase your fees, it will raise your cash balance. But for you to actually spend the money that you raised, you have to get a limitation increase. And that's what Cass is talking about when she says you're going to put it in your agency request budget. Even after you get that fee increase, you won't have the spending authority to use any of that additional money unless the legislator approves it. And so once it gets approved, you have to, that package that will allow you to spend that money, it will need to be included in your budget. And Cass can request it in the agency request budget, but then it has to be recommended by the governor in her budget. And assuming it gets included in her budget, then it has to be approved by the legislator. And so, I don't think that if a 50% didn't get approved, it wouldn't just automatically get kicked back down to 30. It would, I think, get kicked back to you guys with just it was disapproved at 50. And so I don't know how that paints your discussion, but that's just some process stuff I wanted to get on the record. Is there any clarifying questions on that? I know that the process is a mess, so.
Oh, no, actually, that was very helpful, at least for me. I'm curious if it kicks back to us, then would they provide a recommendation at that point of the percentage that we should try and aim for? Or is that it's just up for discussion again?
I genuinely do not know, and I do not
Oh,
want to guess.
I see.
I'm so
Okay.
sorry. I'm a little
No,
bit new
it's
in the
okay.
office, and yeah.
That's okay.
Well, and also what's interesting about all of this is that the board has discretion, statutory discretion to increase their own fees. And what's interesting about kind of fee increase right now versus a fee increase legislatively. And so it's a very interesting kind of dance of how to get everybody on board to agree to all of the fee increase. So Hari, I guess my question for you is if the board was to in September, whatever percentage it would be, 40%, 45%, say, okay, effective in September, this is happening. We start charging that, 40 or 45% increase. If it was not approved by the legislature after GRB, after the governor's recommended budget, and you say the governor's office agrees and it goes through GRB, and then the legislature says, no, we're not going to do the 45%. What happens for those fees during that time? I mean, we're
technically you have to give all of the money back.
Okay.
That's and at least all of the money above, not like what you would have raised anyway, or what your fees are set at, but technically those fees are the word choices that they use are, you're either asking for permission to increase your fees after session, or you're getting your fees ratified in session. If you raise them before the fact. And so if you raise them before going to session, before asking for permission, you're essentially asking for retroactive permission. That the statutory provision where you can increase your fees without legislative approval, that's like permission to raise them temporarily, And so if you go through and read how the fee ratification statute runs, it basically says that if you don't get your fees ratified in session, they will, like, all increases that you do, they're only valid until the end of the next session. And if they don't get approved, you have to give the money back. So that's kind of how that's set up.
Great. No, that makes sense. Thank you for the clarification.
Absolutely.
Hey,
Okay,
Karen,
so-
I was just going to say, for physical therapy, it's $229 every 2 years.
Yeah, I saw
For
that.
PTAs, okay, $157 every 2 years.
So I'm a very timeline thinker. So if we came up with a number and then we have to put it out for public comment, so then we couldn't vote on it until September, can anything happen on the legislative side in the meantime, or do we have to vote on something before it can go that direction? And so then realistically, we're probably not looking at actually collecting increased fees until November or January.
Yeah, I mean, so if
Can things happen at the same time, I guess?
Yeah, so if we enter rulemaking in September for a final, effective as of October 1st, say, it may not become effective on the ground until October 15th, depending on how quickly we can change our programming to allow for those fee increases. That's the only kind of hiccup here is the programming piece.
I know last time Miriam asked for a little bit of a lag because she had already sent notices.
Yeah.
So I think that would push it out 1 month further even.
It could. It could. We could look into, a possible implementation of, mid-October.
Just to chime in on the timeline too, because that is a good way to view this. And I will just say that it's like a little bit scrunched right now with the timing of when we're looking at the fee increase. Ideally, in like a perfect world, we would have known that this fee increase is necessary and kind of started some of this process in like February or January. But stuff happens, and we didn't know we needed this until kind of recently. And so CAS will submit right now the ARB, the agency request budget that is being submitted at the end of July is going to have a 30% fee increase on it. If you guys vote and it's approved to do something other than 30%, by the governor's recommended budget, which for context is due on December 1st, but I'm going to do so much of that early prep work in like October, so the timeline is pretty tight. I can adjust the package essentially with the governor's recommendations. And so if it ends up being 40%, I would change the language in the budget to say 40% instead and increase the amount of spending authority you have to be 40% instead of 30% or 50 or whatever the changed value is. I think the danger of negotiation here is just that it really slows you down a little bit to make adjustments. And that's not to say that, Emily is the LFO analyst. And so if there ends up being last minute changes, like accuracy is important, but I don't think there's like a large amount of time for things to get bounced back and forth between public comment and you guys and then back to my office. And you have to remember that when you submit your in biennium fee increase, again, like it's got to come to me. I have to write a memo, and then it has to go to the DAS director for approval. And I mean, it will move as quickly as possible, but the reality of public administration, like it's not going to fly through there either. And if it gets disapproved, it comes back to you guys, it has to come back to me. I have to write another memo. It's got to go back and get approved again. And so just as far as, rulemaking is complicated with the state. And so I wouldn't bank on like a fast changes or negotiation process.
Thank you. Seth?
Yeah, Hari, do you have any crystal ball insight into what realistically the governor's office might go with and not push back on? I don't want to put you on the spot, but any kind of like feeling gut wise? Because I hear what you're saying, which is basically there's a lot of back and forth here, like a tennis match. So if we could hit a target a little better. So
I don't want to get over my skis here, but the last couple of conversations we've had have been centered around the 30% increase.
Sorry, what did you say? I'm sorry, how much?
Around a 30% fee increase. And so I can't speak on if there was a fee increase that was higher than that. I truly just don't know which direction that would go.
Okay, thank you.
This is Lori. What if we raise the DC application and the DC initial license fee 50% and the remaining 30%? Or instead of 50, 45? Because those are the real big numbers that seem pretty low to me.
I will say that so agencies do, because you guys asked this earlier too, and I'm sorry I didn't chime in then, but agencies do definitely not always increase all of their fees by the same percentage. Like that's in the norm. You don't have to do 30% across the board. You can definitely do some of them higher or some of them lower. I think that the reason that the 30% mark was kind of set is a lot of times there's a priority on how much the renewals cost, just because that is the fee that you charge most often. You get a certain number of initial licenses, sure, but the majority of your revenue is raised through active license renewal. And if you kind of key in on that, the DC active renewals versus the and like the CA renewals, Washington and California just don't charge much more for their renewals than we do. And I think that is kind of the reason why 30%, not set necessarily the cap, but it was like 30% is already kind of high. If you raise those renewals past that, it gets into significantly larger than Washington. But I think that if the DC application was raised more than 30%, there might be a little less pushback. Because as you noted, we do charge significantly less than the other states in that category.
I personally would say that based off of the numbers, everything in our current fee schedule, or not fee schedule, but the current fee that we currently charge compared to the numbers that we would need to, the percentages we would need to reach, I would say that 40% across the board is reasonable. After looking at the numbers here, but that's just my take. I am ambitious and say would throw 50 and kind of what Seth said, real estate negotiation, and see if they'll take 50. If not, then go down. But I personally think 40% across the board is reasonable on every front.
So that's why I think the 50, and then, you know, it's one of the things where you ask for 40 and they give you 40 and you think, damn it, I should have asked for 45. You know, but if you start at 50, then you can, you know, negotiate a little bit. So
but the time it takes to do all that is what I'm concerned about.
Yep. Because didn't Hari say that our time frame with kind of going back and forth is limited?
Yeah.
Yeah, and so that would be, I mean, I'm all about asking for a little bit more. I just don't know that based on the information we've received, that 50% is even in the realm of realistic. I don't know.
But at that point, we are also raising 15%. What did you say, every year, or is every few years anyway? And so hopefully we'd make it up to that markup anyway in the few years after this fee increase.
So my thought is, so I'm sure at 40%, that would be able to be fully staffed, right?
Pretty close.
Pretty close. Okay. Because I feel like the same people that might complain about a 40% increase would then complain about the, you know, lack of help or resources or whatever that you might get by losing a staff member at only a 30% increase, you know? Yeah. So if we could keep it staffed at 40, but then I still think raise the DC application fee itself higher than that to reflect the, you know, additional work that's required in an application. That's kind of where I feel like is reasonable.
Seth, did you have something?
Yes, so I hate this stupid clicky.
Was that an animal walking through?
My skunk. If 40 is pretty close, then why not 45? That's not that huge of a jump. And if it gives the target that we want, but doesn't seem excessive at 50, maybe it's a happy target.
Then at that point, we would say, well, why don't we just go up to 50? Because that's from 45. That's not that much of a difference either. So
they're going to say no to 50.
Yeah. So
50 is going to get drug out in the street and shot.
I feel like 45 is just getting closer to no, whereas 40 is just. I'm curious though. I'm looking at the CA license. Why couldn't we raise that up to $90? Is there a CA? Is it just because of affordability to be able to get that as a CA, or
when you look at fees for CAs, when we're just looking at OBCE fees, not including exam fee, you've got $60 currently for the license fee and $30 for the application, and then they're paying an additional $46.25 to cover the background check fee. So that's kind of how the split works. So when you see where it says CA application fee, that's the total fee, but broken down within that is the CA license fee.
Oh, I see now.
It's not in addition.
And still another 55 to NBCE for the test. So for somebody who's like entry level and only doing 12 hours of training, that can kind of become a lot.
Understood. Yeah, I think at that point, 40% seems comfortable and reasonable on both ends, based off of the information I've heard today.
I mean, you could also do a 40, you know, the 40 or 45%, and then also round up. So we're dealing with manageable numbers rather than kind of random offsets. Yeah. So, I mean, that's another part of this is, to your point, MJ, about the CA license at 87, it's like you can make it 90 or you can make it 85 or,
Right,
so it's not weird computing when we're trying to do that.
Or even then, it doesn't even have to be $60 in the way that you explained it. We could just do that part $78. So it meets that 30% increase for the CA license part and the renewal part for the overall price of it. But, or even, I mean, I guess 40%. Yeah, 40% all around seems, I don't know. I go back to it and I don't know. That seems like the best one to me at this point.
So I just need a solid, what a solid proposal for our red lines would be for public comment, and then we can get out of this rulemaking and then enter it again to enter rulemaking in September.
And whenever you guys want me to pull up a Word document, you just have to decide on kind of a baseline percentage, and then I can pull up the Word document, and then we can kind of adjust numbers based on that. But that's what just let me know when you're ready.
So are we looking at a 40 or a 45, and then are we also looking at an increase in the DC application?
I vote 40. And then an increase in DC application.
I vote 40 with the DC application increase.
Okay, can we get away from I vote? So just because we actually haven't made motions and that's actually a term of art. So Karen, her proposal would be to 40% an increase in DC application. How much of an increase in DC application, Karen?
I think I don't necessarily have to take it higher than the renewal fee. I just think it needs to be higher than it is. So somewhere between $300 and $400 increase. I don't know. What do other people think, number wise?
So 300 to 400. So you're thinking 460 to 560 for application fee?
Yeah, somewhere in there.
I mean, I'd probably take it a little lower and like 450. If we're just trying to kind of balance and offset what Washington does, just because our renewal is going to be a little bit more.
So if we look at the 40% increase column, you go with all those numbers, but then make DC application 450 would be what you think. So then for a Cairo coming in, they would end up paying, what is that, 690, I guess. And so then that is pretty close with Washington, since they don't seem to split initial license fee with application. Am I making any sense?
Yeah.
Okay.
Is the DC application fee a selling point to encourage chiropractors to become providers in Oregon? Or is that just because it hasn't been raised in a while to the same level of the other states?
I think scope has a big part of it too. That may be even more of an incentive than just the fees, honestly.
I wondered if that was like generally known amongst chiropractors that Oregon's scope is pretty broad comparably. Is that generally known?
Yes.
Oh, then let's up it.
What do you mean by scope?
What we're allowed to do.
Oh,
in
okay.
Some states you're only allowed to adjust. You can't do anything else.
I see. I understand now.
Mm-hmm.
So what you're looking at right now on the screen is the 40% draft that we put together. So just to be clear.
So I like Karen's idea, and I think we potentially though round those numbers up, like somebody else had mentioned.
Well,
Yeah.
this is a little hard to read because we're wrapping that fee in. So that's including the 46.25. So then like our fee suddenly becomes like, 140.75 or something like that. So
the ones that would be impacted, so initial application and examination, that's going to be 0.25 cents. So we'll indicate that for you guys, staff can, but some of the ones like senior active annual registration, this one, like it doesn't have a background check associated with it directly. So that's one that would be an example.
Yeah.
I'm gonna put my 2 cents in. I still think 45. I still think a 45% increase. We can go up on the application, the renewal. A 45 looks like it's lower than 50, but it's higher than 40, so it puts us in a nice spot and keeps our ability to provide services at the same.
I just think it might be a little rough because even with this, like you're looking at another $204 for, annual renewal. And I totally understand that's lower than a lot of things, but that is quite the jump.
I don't like the jump, but I don't see that we have that much option. I think trying to maintain our current level of productivity to where do we go get people, because I mean, we still get people complaining now about why my CA lights is not done and why is this and all that. And I mean, it's ridiculous that we have to deal with that, but I feel like to maintain our current level of service. That's just my thought.
Mackenzie, do you have the one with 45 that you could pull up?
Yes, 1 second.
Thank you.
Mm-hmm.
Well, I hope.
Go ahead. Sorry, Michelle.
I hope when it goes out, people understand that we're also raising our own fees. It's not fun for us either.
I was wondering because it's like, oh, this is.
Go ahead, Lori.
What Seth said kind of hit a point, and I was just thinking, like, if my fees were raised, would I pay them? Yeah. Would I grumble about it? Yeah. But ultimately, I don't want to move to a different state. And so looking at it like that, I mean, because if we need it to keep the board active and do what we're supposed to do, protect the public, we need it. So chiropractors, I can't imagine that too many would actually move just because of a fee increase.
Another part of this is the delinquent fee late renewal. I'm looking at G because it's not part of our projections because we just can't project when people are going to be late. But that hasn't changed in a decade. I mean, it hasn't changed in a long time.
For CAs and for DCs.
Yeah.
One thing that, I don't know if this would be helpful for the board to know, but for CAs, sometimes when people are at their like 11 months of before their renewal expires, so like if they expire on April 1st of 2023 and then they get all the way to March of 2024 and they haven't renewed, and then they wait until April 2nd to contact us, then oftentimes there has been, I shouldn't say oftentimes, there can be a desire to just reapply because it actually ends up sometimes being cheaper right now than just going through the renewal process. And that makes a lot more paperwork on our end. It makes a lot of more time for them to be able to work. So in terms of our late fees, that has been an issue with the CAs in the past. Not commonly, but it has come up.
It looks like physicians are $7.45, just for reference, if anybody wondered.
You're talking MDs,
What
Scott?
type of physician, Scott?
Not a chiropractic, a medical doctor.
So was that the
board.
renewal fee, or what was that, Scott?
It seems like
Sorry, I'm
across
going
the
between
board.
screens. Renewal.
My bad. It seems like across the board, we still have the lowest fees comparatively to other states. Am I looking at that right? Even if we did a fee increase?
Sorry, MJ, what was your question?
Across the board, we have lower fees still, even with our fee increase compared to other states. Am I looking at that right?
Depends on the state and what exactly they're charging. But yeah.
Okay. Mostly, I'm thinking mostly about the West Coast, but
yeah,
generally it seems even then, yeah.
We have lower fees and broader scope. So that's what's interesting. So then the last thing I heard was that Seth was liking 45%. Do we want to do 45% and then increasing the DC application to 450? What do we want to do? And then we could also look at the delinquent fees, the late fees. I'm more than happy to up those parts too.
Yeah, let's not cap that at 500. That not to exceed 500. I mean,
for the application, is it 450 plus the background check fee? Or are you including?
In the rule, it's included, not on the other document. In some sections, you have to be.
Can you bring up that, or can you do a side by side, Mackenzie, of the red line and the table?
Lori, what would you suggest if it didn't exceed, if we were to change not to exceed number for the delinquent fee? Did you have something in mind?
I was going to say 5,000. I mean, because what's 125? I mean, we could even change that initial number. What was that? 125? Because 500 it's less than a month. Or just at a month. And so it's like, if we're going to have a late fee and people are going to be late, yeah,
yeah, that makes sense.
I could number crunch here of what, let's see, like 30
I'm
weeks.
wondering if the number was estimated by the actual like doubling the renewal fee, or and I wonder if there was just using that as a reference when at the time they made the delinquent fee, or it's just kind of was just a number they chose at the time, whoever decided that $500.
Yeah, it was literally just a number that the board felt comfortable with. It wasn't
Okay.
based on any calculation.
And Laura, you're saying $5,000 would be the new not to exceed $5,000. And
Well, that would be 40 weeks. That's where I
40
just cut
weeks.
it.
Oh, I see.
Because don't they have up to 1 year lag time to renew? Like they can be delinquent and not renewing. I don't know if I'm using the correct terms, but
They've got a
adoption.
30-day grace period where they still are, like, the late fee is still there, but they can still practice. And then after that, they cannot practice. And then they have until that next year of that expiration date to renew.
So somebody could go on a sabbatical for less than a year. And so that's why I just I just did 40, I think it was 40 times 125. That's how I got up. I didn't mean to interrupt, but I wanted you to know why I just kind of picked that number.
No, that makes sense. That makes sense to me. And because I'm reading it now, it says delinquent fee for late renewal during the 30 days immediately following the renewal date. Then of $125 per week, not to exceed $500. But and you're saying some people can choose to just go on a sabbatical rather than renewing, and they would be penalized.
No, not
For that,
technically.
for that point though, it's not a sabbatical, it's non-renew. They didn't complete the process, and that's their responsibility as a licensee. So if they didn't want to practice, they could renew as inactive for a DC, and they can renew as forfeit for a CA, and they wouldn't pay anything for being forfeit as a CA, and they would pay a minimal fee as inactive. These are people who don't follow through on what's required of them by the board.
Okay.
Do we have, I'm looking at our rule, and actually, do we have a delinquent for DCs? Do we have a delinquent fee for after the 30 days?
That would be the delinquent fee. The 125 per week is the delinquent fee. So if a DC decided to go forfeit for that year, the 12 months, he can do that. If he wanted to come back to active, he would pay the renewal fee, that $500, and he would have to show proof of CE, and then we can change the status at that time. He would still need to pay a new renewal fee for the year that's following up, if that makes sense, for the following year. But they do have that option. If they didn't want to practice during those 12 months, they can do that.
And these numbers were not updated when we looked at fees in 2023.
That's right. No, they weren't. Only the application and license fees were.
So just to make it clear, so that so that we're all on the same page, that delinquent fee is for the 30 days. We may, if we found out that they were actually practicing without the license, then we get into the punishment or discipline phase. So if we're just talking those 30 days, so let's say that mine renews in February. Life happens. I don't do it. I'm not practicing. And then July comes and I want to get my license back. My birthday's in February. I want to get my license back in July. I'm paying the delinquent fee, and am I paying a full active fee in July, and then it'll come back again in February when it's my normal renewal, right?
Correct.
Okay.
We don't prorate.
Yeah. So the 40 weeks thing doesn't, it's not going to be a 40-week delinquent fee. It's a 30-day, right? Does that make sense? So we could raise the weekly amount if we wanted it to be above 500, but it would never be more than that, assuming they didn't practice. They let their license lapse and they want to get it back so they can go back into practice. So we're this is somebody that is not been practicing in the meantime. I said practice a lot. Do you know when the last time that was raised?
I don't. It's been
Well,
a very long time.
Well, so in that situation, the Karen would pay the full year renewal and the $500 because that's what it's capped at, right?
Mhm.
So if we took that out, you took the cap off, then it would be 125 times however many weeks that was, 12 weeks or something, 16 weeks.
But then you'd have to change, wouldn't you have to change the wording because it wouldn't be for the 30 days immediately following? It would be until
True.
Yeah,
renewal. You know what I mean? Like you'd have to change that language.
That's okay. That's why
I
we're going to go
agree.
into rulemaking.
Well, that was my question is if you look at number 1G, you have during the 30 days immediately following the renewal date, and then you go down to the CAs and you have during the 30-day grace and then after the 30-day grace. And I thought, we don't have an after the 30-day grace for the DC side.
Mhm.
Okay.
It seems like there's, I mean, because this happens often where folks aren't finishing CE or they forgot or life happens, where within that 30-day period where they can still work, they're working to get that renewal done. It's the folks who don't follow through with OBCE and don't even realize that their license has lapsed, who could have just forfeited and didn't, is who kind of we're talking about after that grace period often.
Would this, I mean, without getting into details, like, would this help if we didn't have the 30-day cap and it was just, it's this much per week because it took you that long?
Would it take some cases off?
Yeah, you see where I'm going with that? But then
Yep.
it's also, but then there would have to be an end point to where, you can't just like, forever work with, this is just as an early thought. It's just forming in there, but I'm wondering if that would help.
Well, the reminder, this is Miriam. The reminder is that there is a cap if you wanted to do that per week because it would be at the end of those 12 months. After the 12 months, the licensee has to reapply by filling out the application. So there would be a cap.
Okay.
51 weeks. Okay, it is 10:27 and we have a lot of other things. So are we all comfortable with moving forward with the 45% increase? And I'm just going to throw out a $450 application fee plus background.
I'm more comfortable with 40, but I can go with 45.
Is it possible to give staff jurisdiction to just bounce it right back at 40 if DAS says no to 45?
Yes.
Cass? Or
Sure.
Hari?
I mean, that's totally within the realm of yes. If you wanted to have that window, really what we're talking about is what we're proposing for public comment. And so the proposal would be at the 45% with the 450, and whatever the background check fee is, 46.25. And then, and then in the process, so when we go through the rulemaking process and we vote on it in September, not now, but vote on it in September, and if it doesn't pass, then yeah, I mean, you can provide us discretion to say yes if 40% is fine without another vote. We could do that. I'm concerned. I'm reluctant. Frankly, I'd rather call a special meeting of the board to actually have that vote on those numbers, just so that we have it in the record. But
okay.
And what are people's thoughts about changing the language of G for the docs to kind of be the same as the CAs? So we have a fee beyond the 30-day grace.
Yes.
I like that idea since we're going to be opening rulemaking anyway.
Okay, so we're gonna propose the 45, the separate increase on the application fee, and some language to mirror the 30-day or the late renewal delinquent fee, whatever.
Mhm.
Anybody opposed? And then we need to move on.
And then, sorry, we're going to need to renotice this as a whole new rulemaking. So we need a motion to enter rulemaking on this rule in September with these proposals.
And if we're going to edit G, we need specific numbers.
Yeah.
Okay, so first, is anybody opposed to the 45%?
I'll go on record as opposed.
Okay.
Yeah, I think it's a little high too.
I'm good. I agree. 45. So Cass, do we need a formal motion?
Yeah, I just want to make sure that we have a consensus before we make a motion.
Okay.
So,
Sorry.
Seth,
Well, that doesn't sound like much of a consensus right now, but
Well, I mean, all you need is quorum to pass it.
Yeah.
right,
So
cast your vote. Well, yeah, towards what we're motioning for.
I like what we're motioning for. I feel like it gives us room to negotiate a little bit more aggressively.
just
Okay.
so we're clear, though, we haven't had a motion yet. So there's no motion on the table. This is just discussion. So let's just be clear that there's no motion yet.
Right. Micah, are you good with 45? Do you want 40?
I just want to clarify if we aim for 45 and then you said that you would open it to staff to make adjustments if 45 is denied and bring it back down to 40.
So,
Is that what you said?
No, we're gonna change that. So we'll either push it to the next meeting or have a special meeting to vote to have that on record for 40%.
I would feel comfortable if there is a special meeting just in case. I'm okay with it. 45.
Scott?
Yeah, that's fine.
Okay, so I'm gonna go with the 45. So that's what we'll put forward.
So I'm sorry, but that's 45% increase without the 450 DC application and background fee, or is that with
Okay, so
in
now
addition?
let's talk about the initial application. Is everybody okay with 450 plus the background check cost? Anybody opposed? Okay, we're good on that.
Okay.
And then, so now the delinquent fee, let's talk about that.
Okay, so just so we know where it would be caught, if they can have the delinquent fee, or let's say they played out 51 weeks, by the time like the next renewal notice would go out, that's where like Miriam, you'd catch that they didn't do their last year's.
No, if they were to forfeit the license at the end of their expiration or the renewal, the one way we would catch it is if they wanted to reactivate the license. It's not automatic.
Well, I guess what I'm asking is if let's say that we took it beyond the 30 days so that, there's a weekly fee for until they realize they didn't renew, but that it might go a full year until their next renewal date. I guess I just wanted to make sure that if we did that, because I actually like the idea, but that it wouldn't just continue to go on because nobody would ever catch that they hadn't renewed a license. Does that make sense how I'm asking that? Like if we said so that immediately, 125 or raise it to 150 a week, not to exceed whatever that is times 51. Will it, how do we catch it if beyond that end date they're still practicing, but now they don't have a license at all?
Yeah, I mean, it's not the fee, that $500 delinquent fee is not automatically imposed if somebody decides to forfeit the license, unless they want to change that forfeit status within those 12 months to active. That's when they would have to pay that delinquent fee. So anybody that decided I'm forfeiting this year and I'm not going to renew, and 12 months have passed, they don't have to pay the delinquent fee. They can now
Right, because they forfeited.
reapply. So it's not something we normally can. Like, it's not imposed.
Right, but
Right
so
now,
I'm
it's
the
not
one that
imposed.
forgot to do it because I didn't think about it, or I thought I had done it, and then and I kept practicing because I thought I'd renewed it and I missed it, and I kept practicing. Now, at what point do you catch me?
Well, it would be when you go to renew, when you're trying to like renew it. You're contacting the board and you're letting us know, I didn't catch it. I need to renew my license. How do I get the license status back on track? And then that's when we would tell you, this is how much you owe to get it back on track.
Which could be a big amount if it had been, 11 months.
Right. If it changes, yeah. If it doesn't, it would still be that 500.
Okay. But there is a scenario where I could just forget to do it and then I forget to do it forever.
I mean,
in theory. I guess that happens now. That can happen now and you don't know.
Yeah.
But that would also trigger other things.
Yeah, like if you were practicing, then there'd be some type of discipline because of that.
Yeah. The insurance companies, okay, I need your, your current license to stay on the panel. And oops, I didn't do it.
Right.
How do we feel about that? Because, like I was getting at and Michelle got, that it would eliminate some cases. And it's just here's the standard fee and that's that.
Are you, Karen, I'm sorry, are you talking about just not having a cap and just having it at whatever per week? Yeah. Me personally, I've never understood the cap piece. Because it's, if you're going to charge per week, then just charge per week and people are just going to get slammed.
Yeah. And how do you feel? Because it would, would it end the 30 days? It would just be just per week till it's caught.
Yeah.
Like, are we okay with that?
Yes. I think you just take out the 30 days part, and I would maybe change the amount to 150 a week and take out the cap.
Yeah, I like that idea.
Okay, so walk me through the changes you wanted.
So 150 per week, and remove the cap.
This is what you'll have.
I like that.
I think that's really clean. I think it gets to some of the problems too. My next question would be, so the DC application is $450 plus the background check. So where is that indicated on here? So the initial license fee is $450 there.
So the license fee, actually, this might have been my bad. I might have messed something up. So initial application and examination fee, this is where that would show up. So it would be, someone who's good at math.
$496.25.
Thank you.
Yeah.
That does not include the exam, though?
It does.
Okay.
It's the 46.25.
But that's the, okay.
No, 46.25 is the background check.
So what is the board netting from that, if it includes the exam fee?
Does it include the exam fee?
Well, that's what it says.
Miriam?
So
That shouldn't, normally that doesn't include because that payment does not go
No.
to us. The payment goes to NBCE
So
for
this
their
should say,
exam.
so
So
And
this
that's
should say
75
initial,
apiece.
so this should say initial application and background fee, background check fee.
Yeah.
That
Is
needs
it
to be
smart to
redlined.
put in a, is it smart to put in the, are we including a figure for the background check?
This
No.
does.
Well, we are in rule, but if it ever updates like it did a few years ago, we would change it in the rule.
Okay, I was gonna say, 'cause is there any way to, feels like it's such a pain it took us to keep going back and changing numbers if they decide they're gonna charge $47. Could we just say background check fee in the rule and just leave it at that, so it doesn't beleaguer us?
So the PT board one says that it costs this much plus actual cost to the board.
can I ask what the difference between A and B is? Like, why do we have those? Because Oregon doesn't necessarily have reciprocity other than not having to take like part 3 and part 4 from the NBCE. So
I think it's
but
just to
they
show
still have
people
to
that
pay
they're,
the same thing.
yeah, I think it's just to show people that they still have to pay the same.
Okay.
And that initial license fee, so these are all the updated. Yeah.
Did you check? Can you
Did I
check?
check?
Okay.
I didn't check.
Oh.
Mackenzie.
Yeah. No.
You're doing a 45%.
261. I think I removed all of the changes. There we go.
And all the rest are okay though? At the 45%?
Oh, yes. I mean, they should be. I can look really fast.
So while we're looking at this, do we want to round these up? So we could say 45% plus a roundup or whatever, however we want to say.
Yes, that makes sense.
Yeah, 45% rounded to the nearest dollar or whatever.
Yeah.
So these would stay the same.
Yeah.
This one you want 740.
Yeah.
This one. What do you want that to be?
It would be 450. I mean, to me, I would want to make it 550, but that's not to the nearest dollar.
I'm comfortable with rounding it up to 450. I don't know what other people mix.
550, you mean?
Yeah, sorry. Yeah, 550.
And then what about the inactive annual? Take that to 390.
Yeah.
Sure.
This one also, I would love that not to be 50 cents, please.
Sure.
What would you like it to be?
You give and you take.
I might have missed. Why are we not doing that for the initial the A and B doing the
Because
rounding?
of the 25 cents. It's 46.25 for the background check, so it has to have that for coverage.
So don't we need that for the
Well,
CAs also? On
What-
2A. Does that not have the background check in it?
No, this is for the application and this is for the initial certification. And then down here we specify that. So right now it doesn't have that as a part of it, Michelle. So they're inconsistent in the rule.
Can we change that?
We could specify casts like this. I mean, we've broken it down in the past but we could mirror this.
Let's
language.
mirror the DC down into the CA language, just so it's clear that they need to pay both.
So this is what it would look like before I go removing everything. What's the, hold on. $191.25 is the 45%.
$121.
I think it's 191.
Is it?
Yeah.
Sorry, I was saying twos.
That's okay.
Okay, got it.
That's like, oh boy, it could have been on my end though. So we would be removing these two.
Right.
Is everyone okay with that?
We're removed.
What do you mean removing them?
Well, because we've got this. This is for initial application, initial certification. This covers that.
Okay.
So it would be repetitive to have these two.
Okay.
Does that make
So
sense?
CAs only pay once and the DCs pay twice to get licensed.
Right.
Okay.
So we should put certification in A though, then.
So we could do initial application, certification, and background check fee.
Yep.
And then this would be.
For the delinquent fee on the CA, do we want to remove the 30-day cap?
Well, this is 30 days is $25 if you don't renew. After 30 days, it's $50.
So that's a flat fee. It's not a weekly.
Right.
Fee?
That's just a flat fee.
Okay. Does that make sense? I guess, does that make sense? Like maybe if somebody is going from one job to the other, so there's a delay. I don't know.
Well, let me see. So let me actually do a little bit of math off screen. So just 1 second. I don't want you guys to see me doing math. That would be not good for me. So right now, initial license fee based on this percentage increase is $261. Is $191. If a person doesn't renew and they have to pay the late fee, $50, it's $241.25. So this again gets back to what we were talking about before, where if people have wanted to just reapply because they don't want to pay the extra fee for the renewal, and it causes increased paperwork for our office. So yeah.
Do you have a suggestion of how we could approach that to change the language, since we're going to be moving into rulemaking anyway?
I mean, unless we wanted to increase this overall fee, we're still going to have the issue of that fee, the application, certification, and background check fee being less than the renewal fee if the person is paying that $50 late fee. There's just not as much buy-in because the process itself, I mean, they're not considering the $55 exam fee and everything else, obviously, but it's still like there's less buy-in. It actually, with the $55 exam fee, ends up being about the same to renew versus reapply. But I don't know that I have a suggestion. It's kind of an interesting phenomenon that I've seen happen, but it often happens when people are right at the end of their renewal period that they could possibly renew. So like if their expiration date was April 30th of 2023, they're usually at like March 23rd and they're like, okay, I need to renew, but now I have to pay for CE. And then I also have to pay my renewal fee and the late fee. Why don't I just reapply? And then if they go through that process to do all those things, then there have been a couple of situations where people have been very frustrated and they didn't feel like there was enough information given to them where they could make that decision for themselves. I don't know that I would agree with that, but that's just because of what we have posted on our website all the time. But it has happened where people have been frustrated that they had to quote unquote end up paying more for renewal.
Well, don't be late then. Okay.
Well, and I guess the way I'm thinking is I would want to prevent them from being able to reapply and that is kind of where my angle is, close that gap where they can get the cheaper just reapplication. But I don't have ideas of how we could do that. We'd have.
I mean, we were talking about, this is silly, I'm not seriously saying this, but we were talking about how other states had different fees. We could talk about a fee where folks are, I don't know, clogging up the the process. But I don't know how else we would do that, Lori, either. That's just, it hasn't happened a ton of times, but it has happened. And so it's just something for you guys to consider. It might not be something we change in this iteration of the rule, but.
Is there a rule where basically if someone opts to renew rather than instead of renewing they just reapply, is there a rule where if they've had a license for a certain amount of time and they've let it lapse for a certain amount of time and they have to do a renewal, but they instead want to just do an application, could that prevent them from just opting to get a new application and renew depending on when they were licensed? And if they let a certain amount of time go before renewing when they were due for renewal? I don't know if that makes sense.
Yeah, I think it does. Yeah, to me at least. There is not currently something like that, Micah. Basically it's pretty straightforward, whereas like once people apply and are certified, once they get to their first renewal, they have certain required CE. And if they don't comply, then they are unable to practice 30 days after that expiration date. And then we see this a lot where folks just aren't working anymore. And then right at that 11-month, I don't know how it always happens, but right at that 11-month time frame, people really want to renew. But the thing to remember is they didn't renew back in 2023. So then they're mad that they have to pay for the 2024 renewal and the 2023 renewal. So, and it's pretty much oftentimes back to back or within like a couple month period. So some people have been frustrated that they didn't feel like that was clear enough. And then also there have been people who have just waited and then reapplied. And so then they've done the exam and everything else that goes along with that. So they end up staying with the prior certificate number. It's not, we don't like generate any certificate number for them, but then Heather's doing all that work for their application and, you know.
Thank you for explaining that. Thank you.
All right, any other proposed changes before we see if someone's feeling like making a motion?
So to assist, the motion that you're making is actually to enter rulemaking on this rule with the proposed changes.
So Lori, will move to enter rulemaking in September in OAR 811-010-0008. And with the proposed changes of 45% increase across the board, with the exception of the initial DC application to be $450 plus a background, plus the background check.
Okay.
Second.
Beth?
We have a motion and a second. Any further discussion? Okay, we'll vote. Seth?
Aye.
Karen?
So this will be my first time. I agree with part and I disagree with another part. So just on record, do I go nay?
Yep.
Because I'm not 100%. Okay.
Scott?
Aye.
Corey?
Aye.
Nay.
Nay for Corey, aye for Lori. And Micah?
Aye.
And I for myself, motion carries. So we'll go rulemaking in September where we will have more discussion. All right, so that closes rulemaking today for 8/11/010/0008. We'll now open rulemaking for OAR 8/11-010-0085, chiropractic license application requirements.
Yeah, actually, before we get into that, I'm sorry, Michelle, can we all take a 5-minute?
Yes.
Back at 11.